Welcome to the CPMC Van Ness Campus Open Chest Cart video. In this video, we will be introducing you to the general layout of the cart as well as the specific contents of each drawer. The end goal is to better prepare you for an open chest situation in our ICU. Let's get started. Top of the cart. On the top surface of the cart, you will find some quick references. These will guide you with first steps for the workflow of an open chest situation, starting with calling the surgeon immediately. There is also a copy of the CSR algorithm for open chest resuscitation. The binder for our daily and weekly cart checks also sits on top of the cart. Drawer number 1, getting ready. Drawer 1 contains the items you will need to prepare for chest opening by the surgeon. Masks, caps, sterile gloves, chlorhexidine applicators, sterile defib pads, and an IO-band dressing. The surgeon may request the IO-band dressing be placed on the patient's chest prior to opening. Extra cart locks are also found here for relocking the cart after checking, restocking, or opening the cart. Drawer number 2, getting sterile. Time to drape your patient for chest opening. Here you will find sterile gowns, drapes, and lap sponges. Drawer number 3. This drawer contains smaller items organized in transparent and specifically labeled easy open boxes. The pacing wires box contains the temporary pacing wires that the surgeon may place internally while chest is open. Sterile pacemaker cables, a pacemaker generator, and extra batteries are also in this drawer. Another box contains various suturing materials as well as needles the surgeon may need. The intracardiac epi kit box contains the sterile syringe and sterile needles as well as sterile pen and steri strips to label the sterile syringe that will be used by the surgeon to inject epi directly into the patient's heart. Side of the cart. On the upper left side of the cart, you will find the epi box. A vial of epinephrine to be used for intracardiac injection is contained in its own secure box. This box will only be opened during an open chest situation or when pharmacy must access to load the vial. Please refer to the intracardiac epi video for specific instructions on how the epi is prepared. Drawer number 4. This drawer contains the first items the surgeon will need to open the patient's chest. Initial entry tray. As you open the plastic dust cover of the initial entry tray, you will find a scalpel, sometimes referred to as a knife, Yankauer, and a 12-foot suction tubing. The actual initial entry tray will be needed once chest is cut open. Internal defib paddles are also located in this drawer. Note that the label indicates the paddle size to be pediatric or infant. These are the preferred sizes for our adult patients. Drawer number 5. Drawer 5 contains the sterile sternal saw and batteries. This will be needed to cut through the patient's sternum if the patient has had a mini sternotomy or a thoracotomy approach cardiac surgery. Remember, when doing cart checks, the saw batteries are changed every Thursday regardless of the sterile packaging expiration date. This is due to the batteries losing their charge. Saw blades, Bovie ground pads, and Bovie pencils are also located in this drawer. The actual Bovie machine is located in the ICU West main equipment storage room. Please refer to the sternal saw assembly video for details on that procedure. Drawer number 6. Drawer 6 is the bottom drawer of the cart. Most of the items found here are larger in size and need a larger space for storage. First off, you will notice the suction equipment. A supersized suction canister holder as well as a 12-foot suction tubing will be found here. The large cardiac arrest tray is also located in this drawer. It contains many specific surgical instruments on a large tray. Surgical tourniquets as well as tourniquets are also found in the drawer. Extra IO-band dressings are also found here. General tips. Each drawer is labeled on the outside with the specific contents of that drawer. Try to avoid piling items on top of the cart during an open chest situation. This will cover up your CSR algorithm that you will need to refer to during your resuscitation efforts. Whenever you open this cart for weekly inventory checks, Keep in mind an open chest situation. This will help you remember where to find things quickly when the need arises. This concludes the open chest cart video. Thanks for watching.